Welcome everyone to this webinar. My name is Mirjam Plantinga. I'm Associate Professor at the UMCG at DASH, and today I'm the chair of this webinar with the team Navigating AI Regulations in Healthcare Innovation. And this webinar is organized by the Data Science Center in Health. They want to embed data science in the UMCG's DNA because the vision is to be an international leader in data-driven healthcare innovation for the UMCG. And why is that important? I think most of you who are here will know, but we think that data-driven innovation contributes to our goal of building the future of health. And it, of course, also has the potential to transform health and healthcare. Well, how does DASH do that? There are different expertises on machine learning, clinical application of AI, e-health, and clinical cohort data. Of course, also data science. A lot of activities are being done. I won't mention them all for the sake of the time. Also, DASH has a lot of facilities, among which the ELSA lab in Northern Netherlands. I will say a little bit more about that because I'm the leader of the ELSA lab Northern Netherlands, and this webinar is organized together with the ELSA lab Northern Netherlands. It's good to mention that there are several DASH experts with their different teams. As I mentioned, the clinical cohort data, machine learning, e-health, clinical application of AI, and ELSA aspects. So that's my topic of expertise. So I'm the leader of the ELSA AI Lab Northern Netherlands. I won't say too much about it for the sake of the time. If you want to know more about the ELSA Lab, you can go to our website. But what we do is to focus on investigating responsible development and implementation of AI in healthcare by looking at different use cases from a multidisciplinary lens, including a legal lens, and that will also be the focus of today's webinar. We have three speakers with us this afternoon. Professor Jeanne Mifsud Bonnici, she's professor in European Technology Law and Human Rights, and a co-founder of the STEP research group of the Faculty of Law at the University of Groningen. We have Balázs Marcos with us, a PhD in Health Technology and Fundamental Rights Law, also based at the Faculty of Law. And we have Ritumbra Manuvie. She is a postdoc or an assistant professor of law at the University College of the University of Groningen. And I would very much like to give the floor to Jeanne and Balázs, who will start their presentation. And I will stop sharing my... Oh no, sorry, I have a few more announcements. I forgot some rules that we always have. First of all, I can't see you at the moment, but we would like to ask everyone to keep their microphone on mute during the presentation. If you would like to ask a question, please raise your hand and wait for your turn, or you can already type the question in the chat. What we will do is to have presentations of Jeanne, Balázs, and Ritu in one turn, and after that we will have time for questions. So please wait for that until there's time. Also, it's good to mention that the webinar will be recorded and it can be viewed later. We have a YouTube channel, and on that only the audio will be visible, so not the video. At least, well, we will show the presentations, but not the people who are joining this webinar. This is sufficient for now. I would like to give the floor to Jeanne and Balázs for the first presentation.
Thank you very much, Mirjam, for this introduction and for having us today. I will start off with this presentation, which I hope you are all seeing by now, and that you can hear me well as well. So I see that there's a hand up, perhaps. Sarah, would you like to?
Sorry, everything is okay.
Okay.
I think it's lowered again, was a mistake.
Okay.
Yeah.
I was very curious. With the first sentence, I get a question. That's great. No, very good. What we'd like to do first is to slightly introduce ourselves, but Mirjam has done that already sufficiently for us. It's just to say that we both Balázs and myself come from the Faculty of Law, and we're taking very much a development of AI from a fundamental rights perspective, and we have a closer look at what is going on in health. However, it's for us, and this is where we start off today, it's good to think that there is a wide regulatory framework for AI in healthcare. Right now, it's popular to speak about the AI Act, and it is sort of the new kid on the block. But let us not forget that regulating this area does not come from one law only. We will today focus primarily on the AI Act. However, you need to think of it as fitting into a broader perspective. So our picture is a set of wool threads with different colors. And for us, this is how we see the different rules. We could say the GDPR is orange, the AI Act is some kind of purple, MDR, some nice kind of red, and all through this with different hues of the same thing are the national rules on responsibility of medical professionals and national rules on healthcare and so forth. And this is perhaps only a fraction of this whole mapping. As if you're in the area, right, and as we are in the ELSA lab looking at 4 different examples of AI in healthcare, we don't want these laws to remain separate in these separate colors, but we would like to move towards much more of something that is woven to get this cloth to know how we need to prepare for the when can we use AI, who needs to follow which rules, and how do we deploy it in hospitals, in healthcare, in different scenarios. But this weaving, this coming to a picture of how we're going to deal with it is right now a challenge. And what we're going to do with you in the next minutes is to focus, of course, on this forthcoming AI Act. I said in the beginning it's the new on the block, as it were, but it's also the one which is most focused on AI and the challenges that comes with AI development. We will at times look at some considerations of how these how the AI Act will coexist with different rules. And I'm going to anticipate that I think we will leave you more with questions than with answers, because we are all trying to explore this a bit further. And from then we will move to more proposed EU regulation for AI, but now from a liability perspective. And that will be taken up by our colleague, Ritumbra. The AI Act, right, started off in 2021, and keep in mind that it will come in force or come into effect as such in 2026. Some say that this passage of time means that the law, when it's actually going to come into force, it's going to be a bit already outdated. And that's the pessimistic view of looking at the law. On the other hand, we could also say there is this passage that allows us to see the maturity also in the development of the technology and how we are using AI in different sectors, especially also in the healthcare sector. The last step that we've had is that in March, so last month, the European Parliament approved the last text of the AI Act. It will need to be formally approved by Council, and it will go through what is called a legal clarification process to make sure that it's consistent, the terms used are consistent throughout, and then it will come into effect in 2026. So we're very much in the process now. Why is it then important to have a webinar today? You say until 2026, it's another 2 years to come. The law comes with a number of obligations, and these obligations we need to prepare for. And this preparation time is what we need for 2026. What are the differences in the process? That's from what we saw, right? We saw originally it started in 2021 and the actual final adoption is now. There were different positions by Parliament, by Council, and by the Commission. And the text that we have today is really a compromise text. A compromise text, and it tries to, on the one hand, protect innovation and make sure that we're good to compete with the US and China. And on the other hand, it keeps close to the values that are important within the European Union, in particular, the values of fundamental rights. So you see in the Act, and we will come to it a bit later, that there is this challenge, one of protection and making sure that who is being affected by AI is protected, but at the same time not putting additional rules that will block innovation. The law takes very much a risk-based approach. What does this mean? In that it says, okay, there are some activities that it considers unacceptable. So those are not legal, we cannot develop them. AI in those certain situations are not acceptable. Then it says, okay, for some activities where AI, the use of AI is of high risk, then with high risk means a high amount of obligations. With lower risk AI, then much lower obligations, actually very simple obligations if we were to compare. And what is this unacceptable risk? And those are the systems that may lead to manipulation, subliminal techniques or deception techniques, where the person on whom the AI is being used is not able to make a good decision on their own. So exploiting vulnerability, and especially on social scoring, biometric identification, etc. And those, the risk is too high to have these AI used within the European Union. So those systems are considered to be unacceptable. High risks will come with special rules, and we will deal with it. When we started looking at the AI Act and and healthcare innovation, our first perspective was in healthcare we need definitely to protect every use of AI, because every use of AI in healthcare is high risk. The legislator doesn't quite agree with this, and I think perhaps thankfully so, because we do not want to be overprotective that we will then not enjoy innovation that comes from AI. So what types of situations would give risk rise to high risk in health is the question then that we needed to see. And from looking at the definition of unacceptable risks, we saw that, okay, unless we're using those types of AI, so for deception, subliminal uses, etc., then we would not in a healthcare situation fall under an acceptable risk. So then all other innovations in healthcare using AI would fall then with high risk or non-high risk. So if we come to that moment, we need to then come more sharper what is high risk. And high risk has to satisfy two conditions, or rather the legislator comes up with, there are two situations where a development will satisfy this condition of being high risk. Now, satisfies the condition, it's a bit almost a contradiction if we say it like this, right? But we need to think of if the system is such as is in Article 6, then we have additional obligations that we need to satisfy because it is high risk. And these two components both of need to be fulfilled. One is that the AI system is intended to be used as a safety component of a product or an AI system in itself. And these definitions are covered by union harmonization legislation that is in Annex 2. And in Annex 2 of the law, we have a reference to the MDR. So here we see immediately, we cannot think of the AI Act on its own, especially in the context of healthcare, but we immediately are drawn into bringing in the MDR. The second condition is it's not only that it's a system that falls within the MDR, as it were, but it needs to be a product whose safety component has to undergo a third-party conformity assessment. And again, here we're referred to the MDR and Article 52 of the MDR, which we will see in a second in these slides as well. So immediately we know that there are moments of interaction between the AI Act and the MDR. The AI Act itself mentions health and the development of AI in health in another annex, in Annex 3, but in very, very limited situations. AI for a health triage in emergency, AI for insurance purposes that is using health data, and health data that are being used in the context of social benefits or systems determining whether one is eligible for a social benefit. Those three scenarios also automatically qualify as high risk. Those are the only direct references to health in the law itself. The rest comes in this combination with the MDR for high risk systems. But there are also exceptions. And the exception, as we will see, is that we can derogate from what we call a high-risk system if the AI system that we are creating that is not considered as posing significant risk of harm to health, safety, and fundamental rights of people. So even though, right, we're we've just said there's this connection with the MDR, but if the system is not one that is going to pose significant risk of health, of harm, or rather risk of harm and to health, then we could also qualify that this is not a high-risk system. But then you might be asking, but really, who is responsible to determine whether this is a high-risk system or not? And this comes to who are the actors in the act, right? Who are responsible for this? Who are responsible to make these assessments? And a quick look through to the Act gives us a number of actors: providers, deployers, distributors, operators, and each one has some type of responsibility. Primarily in determining the risk level, we need to look at the provider, and we need to also look at the deployer. And we will see both of these, where the responsibilities of both of these actors come in a little bit. Having said that, the law also refers sometimes to user, but it doesn't tell us, it doesn't give us a definition of who the user is. So if we think a little bit back into our sector, right, healthcare sector, who is then the user? Is it a hospital? Is it the practitioner? Is it who exactly is the user? Is it actually the patient themselves when, if the AI is being used directly with a patient? So these roles and responsibilities, there's possibly also an overlap with the MDR, right, with the medical devices regulation, and as we will see also with the AI liability directive, which we will see a little bit later. But in each of these acts, we see that we have different names for different people, or perhaps the same, or rather different names for the same people. This is one of the moments where we need still to identify the weaving. Coming back to, this brought me, right, who needs to decide whether the system is high risk or not? And as we saw, it's rather complex and not necessarily self-explanatory. Especially, it is not self-explanatory because we have to see this interaction with another law. And apart from that, we also have an exception in paragraph 2. Balázs will now take over and explain the relationship with the MDR.
Yes. Thank you, Jeanne, for the introduction and for the first part. Now I will focus on the applicability of MDR to AI in medical devices and the relationship between the MDR and the AI Act. And it's fair to say that it's quite a complex relationship. But what we have to understand is that the MDR is already in force and the AI Act will be in force soon. So they will exist together in parallel. So in principle, a manufacturer or a provider or any actor on the healthcare field has to comply with both of these regulations simultaneously, or will have to. Now let's see what the risk classifications in the MDR look like. The MDR uses risk classes with numbers, class 1, 2, 2B, and 3, and in ascending order. So class 1 is the least risky or the lowest risk class, and 2, 2B, and 3 is the highest risk class. And this brings us to the question where AI devices would fall in this, because they are not specifically mentioned, but software is mentioned in the MDR. And now I think it's fair to say that it's widely accepted that AI forms part of the category of software. So in principle, rules on softwares can be applicable to AI systems as well. With regard to softwares, we can look at Annex 8 of the MDR. And Annex 8 tells us that a software which drives a device or influences the use of device shall fall within the same category as the device itself. So in most cases, it's not a separate category. For software, it depends on the risk category of the device. But sometimes the software can also be used independently of any other device. And in those cases, it could fall into its own risk category. So, and that's what I think would apply to some of these AI systems, which would be used independently of a device. And there is another interesting rule which could be applicable to AI systems. That is in paragraph 6.3, which says that software intended to provide information which is used to take decisions with diagnosis or therapeutic purposes falls into risk class 2A, so not the lowest risk class. And as far as we understood, Some of these AI devices, the ones we are looking at in the ELSA project, would actually be used for these purposes. So to enhance diagnostic capacities, for example, like in medical imaging or genetic data, this would probably fall into risk class 2A. But there are some exceptions. For example, if it causes or a device causes death or serious irreversible deterioration of a person's health, and then it would fall under class 3. So it's the strictest. And in some other cases, it would fall into class 2B, but all other software is classified in class 1, so the lowest class. So it's a fairly complex landscape in itself, and this comes on top of the other obligations in the AI Act. The MDR, as some of you might know, also has its own conformity assessment procedure. These are the well-known CE certification procedures, which are listed in Article 52. And that's manufacturers of medical devices, in most cases, have to conduct conformity assessment before placing their products on the market. And there are different procedures for conformity assessments per risk class. So for risk class 1, the lowest class, it's only declaration of conformity that has to be submitted to a body of conformity. And for devices in categories 2 and 3, there are more stringent requirements. So now let's get back to the AI Act, which also has its own rules on management systems and classification systems. The Article 9 has rules on establishing a risk management system. What is not really clear about these rules is to who these obligations apply. Because it uses a passive voice. So it says shall be established, but it doesn't say who is responsible. Is it the deployer? Is it the developer or another actor? Probably. So this is what we have to find out. And there are other specific obligations these mostly apply to the deployers of high-risk AI systems. For example, setting up technical documentation, keeping record, or ensuring that the AI processes are transparent and information is provided to the deployers. So there are two steps basically, because the producers or manufacturers have to provide information to the deployers, who also have to provide information to the end users. And human oversight is also important. And all levels, the accuracy, robustness, and the cybersecurity of devices shall be ensured. There are some other more obligations. This is also an obligation to the deployers. No, it's an obligation for the providers to ensure that the device goes through a conformity assessment procedure, which is not the same as the MDR conformity assessment procedure. So we also have to see how these two assessment procedures are going to relate to each other. And on top of all this, there is also another obligation, which is clearly on the deployer, is to conduct a fundamental rights impact assessment. This is going to be the topic of my PhD, but today I will keep it short because there are some specific obligations. They have to describe how the system works and how it affects fundamental rights of specific persons. So, or specific groups of persons who are affected by the system. So, in cases of medical AI, it would be mostly an analysis looking at how patients' rights are affected and what oversight and compliance mechanisms are there. So that's also on the deployers. What is the yeah, this I'm going to skip, and now we are going to focus on AI that is not high risk, because all of this, what I previously said, was about high risk AI. For non-high risk AI, there is basically one main obligation, which is transparency. So there are transparency obligations, and the developers and the deployers need to be able to explain how a system works and what effects it might cause. And providers can make sure that AI systems which interact directly with natural persons, the natural persons will get the information, reasonable information, what to expect during the use of an AI system. So this would also apply to in a patient, doctor, or in a healthcare context, probably. So our conclusion is it's an interim conclusion because this is all work in progress. But we can say that the legal landscape is highly complex, and that there will be simultaneous obligations with several regulations, because there is the AI Act, there will be the AI Act, there is the MDR, and so all these other regulations, there will be enforced together at the same time. So sometimes it's unclear who has to do what, who has the obligations under the AI Act, and there are possible overlaps between functions. So we hope to get a clearer picture in the upcoming months and years. Thank you.
Thank you, Jeanne and Balázs, for navigating us through the AI and the MDR. I can mention there are some questions. Elisabeth, I also saw that you raised your hand a few minutes ago. Maybe we can save the questions for later if it's okay with you. And I already saw that there's a question in the chat. So maybe while Ritu is giving her presentation, Jeanne and Balázs, you could maybe already have a look at that. Yeah, I would like to ask Ritu to continue, and if it's possible to shorten the presentation a little bit to 10 minutes so that we have still some time at the end for questions that people have. Ritu, the floor is yours.
Thanks a lot, Mirjam. I will try to share my slides. Are you able to see my screen and my slides?
Not yet. I think it's coming. Yes. If you could put it in.
Can you see my slides?
Yeah, but not yet in presentation mode.
Yes, because I haven't put them in the presentation mode yet. Can you see them in the presentation mode now?
Yes.
Okay, great. So I'll be talking about the artificial intelligence and intelligence, the EU liability regime. And I do want to start by saying that the EU liability regime on AI is still very much a work in progress. But hopefully I would be able to walk you through some of the interesting developments that have been happening and that can be taken account of. So first of all, there are two pathways for the liability when it comes to AI, and we are talking about more general AI over here, not necessarily specifically on health AI, but health AI would, or medical use AI may, as Jeanne also mentioned in her presentation, whether it falls within this liability framework or not is something to be seen as well. So we have two different pathways here. One is at the union level, which is the Product Liability Directive. And then at the national level, we have national liability rules. And these national liability rules are usually based on this idea of victims be able to seek compensation based on a fault-based liability where damage is caused and a fault and causality of the damage causer can be established. A strict liability where there might be a correlation between the damage caused to the victim and the damage causer, but it's not necessarily a direct causality. And the third principle that usually works under the liability laws is the claim against the producers of the product, which could be the defect of the product or some kind of causal linkage where the defector or the product manufacturer itself can be made liable. Other than this, there's also several other bases for liability laws to take shape in a national legislation. So national liability rules, primarily they rely on the civil and the tort law jurisprudence. And whereas the civil and tort law jurisprudence give us the logic to establish whether a damage has been caused and whether the damage is caused by a certain action of the damage causer, it doesn't necessarily give us the rules to determine how much this damage should be and what kind of compensation should be paid. It also don't always give us the rules to determine that what should be the severity of the damage or the severity of the evidence or proof that is required to say what kind of damage is caused. So in that sense, a case-by-case liability usually is developed in the national settings. And this creates certain uncertainty for all the parties involved, as you can imagine, because a victim who's damaged or a patient who's damaged may want to seek certain damages, but they also do not know how much they can seek. And at the same time, it also creates liability on the people who are on the serving side, where they also do not know what kind of damages. So, but this is the state of art in the law in general, and there is at the national liability rules as well a lot of gap in understanding how to quantify these damages. Then you can imagine that if we are talking about national laws, then we are in Europe itself, we are talking about 27 different nations. So there is a lot of fragmentation across different nations in Europe as well on how these liabilities need to be established. And therefore, there is a sort of like an ad hoc liability system, which is working where member states courts quantify the damages, whereas the damage, the legal rationale of whether a damage is produced or not, is caused or not, is produced elsewhere. And this legal certainty has basically also led to the formation of the Product Liability Directive at the EU level to sort of harmonize how we determine whether a damage is caused, not ascertain the level of compensation, but how do we determine a damage is caused and who has caused it, who has the burden of proof, and how the evidence should work, etc. So to overcome that legal uncertainty, this has been done. And when it comes to the AI, we are still at sort of like a crossroads, because as I will walk you through further on in my presentation, that in terms of AI, this legal uncertainty and legal fragmentation is really huge, because we also do not know much about what kind of AI can be deployed or used. So it just adds to the layer of the uncertainty. And it also, in that sense, creates a liability on the EU policymakers, as well as national regimes, as well as people working around to actively think about what could this liability regime may look like. So at the EU level, there is a bit of a push right now to sort of overcome at least the fragmentation at the national levels, and sort of determine the AI liability more broadly at the EU level as well, so in form of the EU law. But and this is sort of visible from the EU white paper on reconsidering liability in terms of AI, where the EU stressed, the European Commission stressed that the people who suffered harm caused by involvement of an AI system should enjoy the same level of protection as people having suffered harm caused by other technologies. At the same time, they also recognize that innovation should not be allowed, should not be stopped, and we need to create an environment, a regulatory environment where innovation is able to develop. So these two recognition, which are sometimes, well, it is actually part of the same tapestry, and these two recognitions are really important. And with this recognition now at the EU, we are at a proposal stage for a directive on AI liability. So the directive itself is AI Liability Directive. And what this directive does is that it lays down common rules on disclosure of evidence on high-risk AI system. Now, you have already heard, I think, and you might have some questions. I'm going to also leave it for later because Mirjam already told me to shorten it up. But you have already heard a lot about the high-risk AI system and how does that translate into the medical field. So for the AI Liability Directive to take effect, the disclosure of evidence on high-risk AI system is what is also sort of required to enable, so that a claimant who's a victim can substantiate a non-contractual fault-based, civil law claim for damages. And this is also in that sense, it's sort of giving the tool to the victim or the claimant of the damages to just ascertain that there has been a causality or a linkage between a high-risk AI system and the damage caused to them. Whether this system is a high-risk AI system or whatever system we are using in the medical field, are they high-risk system, that is still to be seen. Another thing that the directive does is that it lays down the burden of proof in case of the non-contractual fault-based civil law claim before the national courts, brought before the national courts for damage caused by an AI system. What it means is that it sort of reverses the burden of proof, that the parties, the victims, there will be always an assumption that if there is a high-risk AI system, then it has perhaps caused damage. But this presumption is rebuttable presumption. So which means that the parties or the deployers or the users of the AI system can actually rebut it, that this is not a high-risk system, or this was not an intended outcome, etc. So this burden of proof is taken away from the victim, but at the same time, because it is a rebuttable burden of presumption, it also does not necessarily implicate the deployers and the users in a strict liability sense. The fault still needs to be established. Another thing, what the directive will not do is that it will not apply to criminal liability that might arise, and it will also not affect national rules. So if the nations come up with certain legislation, especially if these legislations are more favorable for the claimants and the victims, and they are not going against the rule, the union law itself, like they're compatible with the union law, the European Union law, then these legislations will take primacy over the proposed act at the moment, at least. We don't know, maybe this language changes. Then again, as I said, the disclosure, so the two things, what the act does is disclosure of evidence and rebuttable presumption of non-compliance. But who is liable, how that liabilities has to be quantified, what compensation can be given, how that compensation has to be quantified, what kind of evidence is required to cause the connection of causality, that is still left to the member states to determine. So that's still in the national legal system that would have to be taken care of. but it will, in a sense, it will give a right to the claimant to seek disclosure of evidence so that they can present their case and they can argue on their behalf on whether an AI system led to a harm to them or not. So that right itself to the claimant is also important in terms of their protection. And another interesting thing that we found in this proposal was that the AI liability directive proposal, it takes the definition, it borrows the definition of AI system, high risk AI system providers, and also it says in the proposal user as defined in the AI Act. But at the same time, when it comes to, I'm going to skip one of my slides on product liability, but when it comes to the definition of these terminologies, um, you can see from the table that we made here for you that AI Act, MDR, and AI Liability Directive do not really have a very uniform or harmonized use of terminology. For example, in case of AI Liability Directive, it says that the user is defined in AI Act, but in AI Act there is no user definition as such. It just provides that the user should get an AI, system in a way that is acceptable and is not causing violation to their fundamental rights. So, but it doesn't really define what user means. The MDR does define user, but then MDR also does not strictly adhere to the same kind of definition that AI system have on high risk AI systems, or what is an AI system. In fact, AI Act leaves the high risk AI system also in a little bit to MDR. So ultimately, what we do find out in this is that MDR itself perhaps will have an influence on determining what the AI liability is. So first, the classifications under MDR will determine the liability under the AI Act, and therefore it will also in some ways influence how these liabilities are then constructed under the AI Liability Directive as well as the Product Liability Directive. I do want to touch upon a little bit on the Product Liability Directive over here. There is a revision proposal on the Product Liability Directive, which is separate from the AI Liability Directive at the EU level. And that proposal, the revision proposal, does want to acknowledge software as a product, which will mean that software must, if the software is considered a product in the scope of the directive, the defectiveness of this product, including lack of software updates under manufacturer's control, as well as failure to address cybersecurity vulnerability, will introduce some kind of liability for, defective product. And this will elevate the burden of proof from the victim, because under certain conditions, it may become more apparent that yes, there were necessary vulnerabilities within the system by which this product, by virtue of which this product failed to deliver how it did, how it delivered, or delivered how it delivered. Then finally, the AI liability at the union level, it recognizes fault-based liability. So this is not a strict liability, and we hope potentially that this will remain a fault-based liability, which means that there will always be a rebuttable presumption of fault. And the AI Liability Directive will also respect national law, but at the national level, whether we get a fault-based liability, whether we get a strict liability, or we get something else completely, we do not have clear picture of that at this level. So as I said at the beginning of my slides, that the takeaway is that the AI liability is a work in progress. Member states have better experience in governing liability than the union has, because member states have had liabilities, one of the oldest sort of damages, and liabilities, one of the oldest sort of laws. So member states definitely all across Europe have much more experience in governing the liability. And they also have much more experience actually governing under the Product Liability Directive, because that has been in place for some time. Only thing that was lacking is that it does not had software as a product until now. But if the revised proposal moves forward, then it will have that. At the EU level, we hope for a harmonization of terminology between EU instruments, at least that's desirable. And that's it. That's where I will end my presentation. I hope that was short enough.
Thank you, Rita. A little bit shortened, it's fine. Thank you. So we have some time for questions, and in the meantime, also I think Jeanne tried to answer the questions in the chat. Maybe with regard to the last one, you can maybe say a little bit more, Jeanne, because I think the difference between in-house developed AI and bought-in AI is quite important for us. So can you say a little bit more about that and to what extent AI will impact that?
Indeed, Mirjam, this is in one of the recitals. So the recitals is the sort of the thoughts, the basis upon which the act in itself has been built. So this is the preamble to the act itself. Thank you, Balázs, for that. But it's not the binding part of the act. There is where we have a reference that we, in particular in healthcare, we can have a different, or rather institutions, public authorities, or rather public authorities and institutions can put up their own quality systems and also determination of the risk. How this will work out is not immediately evident in the act and is probably subject to a delegated act that will come from the European Commission at a later stage. So this is a space of development, but it's a hopeful space. And I think this is where a lot of, perhaps not very elegantly put, I think there's a lot of lobbying going on making sure that this is as smooth as possible transition, but we do need the delegated act from the Commission to be able to facilitate this from the recital to the act itself. I don't know whether this was the intention of the question and whether this is clear.
I see Elizabeth nod, so I think it's more clear now.
Thank you.
Thank you. Are there any other questions for Jeanne, Balázs, or Ritu? If so, maybe people can raise their hands. It has been a lot of information, and as you said, probably more questions than answers have been given.
I think it's a very nice moment. Well, for us lawyers, we say it's a nice moment because it is now that we're really going to form how the law will act, how we will actually comply to it. Finally, we have the rules, or at least the start of the rules written, and now we can start forming the compliance part.
Yeah, and maybe for me to understand, so it's not that one law has precedence over another law, is it? Or can you say a little bit about that?
We do not have a hierarchy of laws within these laws. The hierarchy, if you could put it this way, is between the treaties of the European Union and then the secondary legislation. But here, they're all on equal footing, but they really need to coexist. One of the suggestions, as Ritu, I think, put in her takeaways, is that we would like to have almost harmonization of terminology, because in one we have manufacturer, in the other we have producer, we have deployer, we have user. And this we have not even touched on the terminology of the General Data Protection Regulation, where we have controller and processor and data subject. So these different terminology all come with obligations. Sometimes they overlap, but they're not completely the same. So one of the exercises we'd like to be doing, and we are doing in the ELSA lab, is trying to make a map of the different actors mentioned in all of these acts to try and understand where they overlap and where they don't.
Yeah, and I can imagine really the concrete application of AI use cases will also lead to answers in this way, because I think different parties will bring forward or use different laws to their benefit, and then their discussion will be what is the best or a good interpretation or not. So I think it will be a discussion and a debate indeed for some years. As I don't see any other questions, I would like to finish this webinar by mentioning a few upcoming meetings. I will try to find my slides again. First of all, I want to point you to a video on a day that has been hosted by the Antina Thomas School of the university, which was also on this topic, the AI Act. So if people want to know more about this, then I can also recommend watching the video of that meeting. And then we have 2 more meetings upcoming from DASH. First of all, in a month, we have a new webinar, this time on neurology, unraveling disease pathways with AI. Again, same time online. And we also have a live event forthcoming on large language models in healthcare. That's in June. It's in the UMCG, and everyone is invited to attend these as well. Finally, I want to mention that if you want to know more about what DASH is doing, you can follow DASH on LinkedIn. You can send us an email. There's also information on the website, and we also have a monthly newsletter where we put in all the new things that are going on in terms of activities and new information that's coming up. So this with regard to the information and forthcoming events. Then I would like to finish by thanking the speakers, Jeanne, Balázs, and Ritu, for your presentations and navigating us through all these different laws, and of course all the participants for your presentations. And I hope to see everyone soon at another DASH webinar. Thank you, and have a good evening.